Hello, I'm Dr. Khansari, and today I'm going to explain to you about one of the many procedures that we perform in our office. Dental implants are replacement teeth that feel, look, and function like a natural teeth. If you are missing one or more teeth, dental implant can regain you that normal function, and also you would be able to confidently smile again. They are like a small titanium screws that we place them in the jawbone where the teeth are missing. A process named osseointegration would allow the titanium screw bonded to your jawbone. That creates a strong bonding and foundation for a new tooth. This procedure normally we can do it under local anesthesia, followed by a raising small flap to gain access to underlying bone. Then we start doing prepping the bone by creating small channel into the bone to the size of the implant. When we're placing the implant into the bone, it takes about between 3 to 5 months for the complete healing before we load the implant. Dental implant has 3 different components. So the actual titanium screw which works as the artificial root. The second component is the abutment, which is a kind of a small post which support the final restoration. And the final restoration, which is the crown that replaced the missing tooth. Dental implant, they have a very good long-term prognosis.